Have you ever worried, what if a stroke is developing inside my brain, and I do not know it yet? We often imagine a stroke as a dramatic event, like a lightning bolt from the sky. We think of someone suddenly collapsing in a restaurant or losing consciousness instantly. While that does happen, the reality for many seniors is much more subtle. The brain often whispers before it screams. There is a terrifying concept in medicine called the silent stroke. These are small blockages or tiny bleeds in the brain that do not cause you to collapse, but they slowly chip away at your ability to move, think, and balance. Today, I am going to teach you 3 detailed clinical tests that neurologists use in the hospital to uncover these hidden signs of brain weakness. These are the exact same exams a specialist would perform if you walked into their clinic complaining of dizziness or mild weakness. By the end of this video, you will not just learn how to move your arms, you will understand the biology of why your brain controls your muscles the way it does, and how a simple 30-second test can reveal the health of your arteries. You do not need fancy machines for this. You just need your body, a firm chair, and about 14 minutes of your time to learn this life-saving skill. Before we begin, I must state a critical medical disclaimer. This video is for educational purposes only. It does not replace a professional medical examination. If you or someone you are with is currently experiencing sudden severe symptoms, like a drooping face, sudden loss of vision, inability to speak, or a thunderclap headache, do not watch this video. Call your emergency services immediately. Time is brain, and you must get to a hospital. However, if you are feeling generally okay, but want to be proactive about your heart and brain health, you are in the right place. Let us start by understanding the connection between your heart and your brain. You might wonder why a channel named Dr. Heartwise is talking about brain tests. The answer is simple. The health of your heart dictates the health of your brain. When you have high blood pressure, it hammers the delicate arteries in your brain day after day. Eventually, these arteries can narrow or burst. When you have an irregular heartbeat, like atrial fibrillation, your heart can throw small blood clots up into the brain, causing blockages. Therefore, testing your brain function is actually one of the best ways to check if your heart health plan is working. Let us move to test number 1, the Pronator Drift Test. This is the gold standard for detecting mild upper motor neuron weakness. But to do it right, you need to understand the physiology of what we are looking for. Here is the science behind it. Your brain controls your muscles through a pathway called the pyramidal tract. It sends signals down your spine to your arms. In your arms, you have 2 main groups of muscles that twist your hand. Group 1 are the supinators. These are the muscles that turn your palm up, like you are holding a bowl of soup. Group 2 are the pronators. These are the muscles that turn your palm down, like you are typing on a keyboard. Here is the secret. In the human body, the muscles that turn your palm down are naturally stronger than the ones that turn your palm up. It is a constant tug of war. When your brain is healthy, it sends a strong signal to the palm-up muscles to keep them fighting against the strong palm-down muscles. It keeps everything balanced. But if there is a subtle injury in the brain, perhaps a very mild stroke or a small blockage, the brain signal gets weaker. When the signal gets weak, the stronger muscles win the tug of war. Gravity takes over. Your arm drifts down and your hand turns over. This is called pronator drift. Now that you understand the why, let us do the test together properly. I want you to take your time with this. Step 1 is your position. Please find a firm chair. Do not sit on a soft sofa or a bed, as your body needs to be stable. Sit up straight with your feet flat on the floor. Take a deep breath and relax your shoulders. Many people hold tension in their neck, which can ruin the test results. So shake your shoulders out gently. Step 2 is the setup. Raise both of your arms straight out in front of you. They should be at the level of your shoulders. Now turn your palms strictly upward toward the ceiling. Spread your fingers wide. Imagine you are balancing a flat tray on your hands. Lock your elbows so your arms are straight. Step 3 is removing your vision. This is the most critical step. I need you to close your eyes. Why do we close our eyes? Because your eyes are powerful. If your arm starts to drop, your eyes will see it and your brain will automatically correct it. We do not want that. We want to know what your brain does when it cannot see. So, with eyes closed, hold this position for a full 30 seconds. I will count a few seconds with you. Keep holding. Do not stiffen up. Just hold them naturally. Keep holding. Now, open your eyes and let us analyze the results. What does a normal result look like? In a healthy brain, both arms should remain roughly at the same level. They might bounce or waver a tiny bit due to natural fatigue, especially if you have shoulder pain. That is normal. Crucially, your palms should still be facing up. What does an abnormal result look like? We are looking for 3 specific signs of the pronator drift. Sign number 1 is the drift itself. One arm slowly sinks downward while the other stays up. It is usually smooth and slow, not a sudden drop. Sign number 2 is the rotation. This is the pronation we talked about. You might look and see that one hand has turned inward, so the palm is facing the floor or your thumb is pointing down. This suggests the palm up muscles lost the tug of war. Sign number 3 is elbow bending. Sometimes the arm pulls back toward the chest and the elbow bends slightly. If you see these signs in yourself or a loved one, it suggests a weakness in the motor pathways of the brain on the opposite side of the body. If your right arm drifts, the problem is likely in the left side of your brain. If this is new for you, it warrants a visit to your doctor to discuss an MRI or a neurological evaluation. Let us move on to test number 2, the facial and speech challenge. This test focuses on the cranial nerves. These are nerves that come directly from the brainstem to control your face and tongue. Let me tell you a quick story about a patient we will call Mary. Mary felt fine, but her husband noticed that when she drank her tea, a tiny bit of liquid would spill from the corner of her mouth. She thought she was just being clumsy. Later that week, she noticed her voice sounded a little bit thick, as if she had a cold, but she felt healthy. These were subtle signs of muscle weakness in the face and throat. Mary was having what we call TIAs, or mini strokes. We want to catch these signs early, so here is how we test the face and speech in detail. Part 1 is the visual inspection. I want you to go to a mirror or use the selfie camera on your phone. Look at your face at rest. Look at the folds of skin between your nose and the corner of your mouth. Is one side deeper than the other? Look at your eyelids. Is one eyelid looking heavy or drooping lower than the other? Now, I want you to make a very exaggerated movement. Smile as big as you possibly can. Show all your teeth. What we are looking for is symmetry. Does one corner of the mouth lag behind? Does one cheek stay flat while the other rises? In a stroke or brain injury, the lower half of the face on one side often becomes paralyzed. Part 2 is the tongue and speech test. Stick your tongue straight out. Does it point straight ahead, or does it curve to one side? A tongue that consistently points to the left or right can indicate nerve damage. Now for speech. I want you to try a specific phrase that tests the coordination of your lips and tongue. Repeat this sentence out loud. The sky is blue in Cincinnati. We use this sentence because it requires crisp consonant sounds. Listen to yourself carefully. Are the words crisp and clear? Or do they sound mushy, like you have marshmallows in your mouth? Do you have to search for the words, or do they flow automatically? Slurred speech, or dysarthria, is often one of the first signs that the small blood vessels in the brain are struggling to supply enough oxygen to the speech centers. If you notice new asymmetry in your face or new thickness in your speech, This is a major warning sign. Now we move to test number 3, the cerebellar coordination check. The cerebellum is a beautiful structure at the back of your brain. It is responsible for fine-tuning your movements. It is what allows you to touch your nose with your eyes closed or walk a straight line. Strokes in the cerebellum can be very tricky because they often do not cause weakness. You are still strong, but you become clumsy and dizzy. People often mistake cerebellar strokes for just being tired or having an inner ear infection. Here is how we test it with the finger-to-nose test. Sit comfortably again. Take your right index finger and touch the very tip of your nose. Now, reach out and touch a target in front of you. If you are alone, just reach out to full extension in the air. Touch your nose. Touch the air. Touch your nose. Touch the air. Do this as fast as you reasonably can. Now close your eyes and try to do it. Touch your nose. Reach out. Touch your nose. Reach out. What are we looking for here? We are looking for something called dysmetria. This means wrong length. In a normal brain, your finger lands on your nose perfectly every time, like an airplane landing on a runway. In a brain with a cerebellar issue, the finger might crash into your cheek. It might poke your eye, or it might stop 2 inches before it hits your nose. You might also see a tremor, where your hand shakes more and more as it gets closer to your nose. Check your left hand and your right hand. If one side is smooth and the other side is wild and clumsy, that is a specific sign of a problem in the coordination center of the brain. So, you have done the 3 tests. You have checked for pronator drift to test motor strength. You have checked your face and speech to test cranial nerves. You have checked your finger-to-nose coordination to test the cerebellum. What do you do with these results? I want to categorize your next steps into 3 urgency levels. Level 1 is the emergency zone. If you discovered that you cannot lift one arm at all, if your face is clearly drooping on one side, if your speech is completely slurred or you cannot find words, or if these symptoms started suddenly in the last few hours or days, you must call emergency services. Do not wait to see if it gets better. There are treatments for stroke that only work if you get to the hospital quickly. Level 2 is the urgent evaluation zone. Let us say you did the drift test, and your arm drifted down slowly, but you feel fine otherwise. Or let us say your coordination is a little off on the left side, and it has been that way for a few weeks. This is not necessarily a 911 call, but it is an urgent appointment with your primary care doctor. You need to tell them, I did a home exam and noticed drift in my left arm. They will likely order a brain scan and check your heart rhythm for atrial fibrillation. Level 3 is the prevention zone. If you passed all these tests with flying colors, congratulations. That is wonderful news. But do not get complacent. The fact that your brain is healthy now is a gift. You need to protect it. The number 1 enemy of your brain arteries is high blood pressure. It acts like a fire hose, blasting the delicate walls of your vessels. Make sure you are checking your blood pressure at home. Keep your cholesterol in check. And stay hydrated. Dehydration can make your blood thicker and more prone to clotting. Remember, your body is always talking to you. The drift of an arm, the slur of a word, the stumble in a step. These are messages. Most people ignore them until it is too late. But by watching this video and doing these tests, you are choosing to listen. You are choosing to be proactive. I want you to try these tests on your spouse or a friend today. It is sometimes easier to see these signs in others than in ourselves. Watch their arms. Watch their smile. You might just save a life by noticing something they missed. If you found this detailed explanation helpful, please consider subscribing to our channel. We are building a community of people who refuse to let their health deteriorate in silence. Share this video with someone over 60 who you care about. Stay heartwise, stay brainwise, and I will see you in the next video with more tools to protect your health.